if you're a parent or carer that is caring for a child that's experienced trauma, then trauma-informed care consultations might be recommended to support you and your child. But what are trauma-informed care consultations? Let's take a look. I'm now going to walk you through a trauma-informed care consultation, what they are, why they matter, and how they can support you and your child. So what exactly is a trauma-informed care consultation? To put it simply, it's dedicated time with the consultant and someone who is supporting the child. This is usually a parent, carer, or other professional. During this dedicated time, we work together to understand the trauma your child has experienced and importantly design and help you implement trauma-informed care that can help your child heal. This process is all about working collaboratively. No one knows your child better than you do, and it's the role of the consultant to help guide and support you in making meaningful adaptations for your child and your family that work for you. In a trauma-informed care consultation, the first step involves gathering as much information as possible to understand the trauma your child has experienced and the current presenting needs. We want to talk about what's going well and the challenges and concerns that you're managing through each day. Essentially, the consultant will want to understand what you would like support with. The children that we support have lots of different needs and often display a wide range of challenges. Trauma-informed care consultations can support with many needs including challenging behaviours, self-harm, absconding, toileting challenges, sleep difficulties, attachment difficulties, delays in emotional or social development and many more. Once the consultant fully understands your child's needs and what areas you primarily want support with, they will use the information gathered and their trauma-informed care knowledge to develop care interventions that can support your child to heal. Once the consultant has considered how to support your child's individual needs and has a plan, a core part of trauma-informed care consultations is supporting you to implement the care and intervention. The consultant will walk you through how you can help and support your child. So let's take a look at an example. So Joe is adopted and is 9 years old. When living with his birth family, he experienced neglect whereby his needs were not met and witnessed domestic violence incidents between his mum and her partner. Joe's adoptive mum reported that Joe's behaviour is becoming a big concern for them. He shouts and screams at his parents, and this is now escalated to him hitting his mum and siblings. Simple tasks like getting ready for school or putting things away after himself seem huge tasks for Joe. His mum and dad asked for trauma-informed care consultations to help them support Joe. They're worried things could get worse if they can't provide the support he needs now. This is a common challenge that families come to us with, and trauma-informed care consultations can support families in these situations, designing care and intervention that considers the presenting needs of the child and their past trauma to ensure children are supported to heal. Trauma-informed care consultations help Joe's family by helping them understand his trauma history and how this has impacted his presenting behaviours. The consultant developed strategies that are both evidence-based and function-based, meaning they are backed up by research and tailored to Joe's specific needs. Also, the family received hands-on support, meaning the consultant not only walked them through the strategies but showed them how to implement each strategy. Trauma-informed care consultations go beyond just providing advice. They provide a compassionate, non-judgmental space where families feel heard, bespoke evidence-based and function-based care and intervention tailored to each child's individual needs, hands-on support to guide parents and carers in implementing advice effectively, and ongoing progress monitoring to ensure interventions are working and adjustments are made when needed. Now you have a clearer picture of what a trauma-informed care consultation involves and how they can help you make a difference to your child. In our upcoming videos, we will dive deeper into our intervention approach and the core elements of trauma-informed care consultations and how they're effective in helping children and young people who've experienced trauma. We'll also discuss how we empower families to navigate through challenges to create lasting positive change. If you want to know more, then check out our next video in our trauma-informed care consultation series. But before you go, here's one final trauma-informed care tip. Trauma-informed care consultations include lots of different components which make them effective. And over the years supporting parents and carers, we know that if any of these components are missed, this will make support ineffective. So my tip for today is, if you're receiving trauma-informed care consultation, watch this video series. This will help you understand trauma-informed care consultations and how they're effective to get the most out of your support. Be sure to check out our next video and don't forget to subscribe to Tribe for more trauma-informed care in practice.